Good morning, Mrs. P. I'm Mahdia Malisa, student nurse Mahdia Malisa. I am just here to do a postnatal assessment of you. I just want to confirm your identification. Are you really Mrs. P? I see here on the file that it is written Mrs. P. Can I just see your armband? Thank you, Mrs. P. But basically, a postnatal assessment is it's a general systematic assessment done after the delivery of your baby to just check your well-being after the delivery of. Is it okay if I continue with the assessment, ma'am? Okay, thank you. I'm going to ask you general questions about your antenatal and your interpartum history. Is that okay, ma'am? How many pregnancies have you had in the past, ma'am? Okay, 4. How many live babies do you have now? Okay, you have 3 babies. And have you ever had any termination of pregnancy, any miscarriage? Okay, you've had 1 miscarriage in the past. Okay, thank you. Have you ever had any previous sections in the past? Okay, all your babies were delivered normal vaginal delivery. Okay. Have you ever had any issues in your previous pregnancies? Okay. And have you ever had any issues in your present pregnancies? Okay. Were you able to attend all your scheduled antenatal clinic visits, ma'am? Okay, thank you so much. Okay, ma'am, we're gonna start with the assessment rather. I'm just gonna close and screen for privacy so we can do the full body assessment. Is that okay? Thank you so much. Mrs. P, please position yourself comfortably. Are you sitting comfortably? I just wanna ask, were you able to empty the bladder? Okay, are you comfortable now so we can start with the assessment? Okay, thank you. I'll be wearing my gloves. Okay, we're gonna start first, ma'am, by evaluating for any signs of anemia. A lot of pregnant women present with anemia after delivery due to any hemorrhages during the delivery, and also mothers who had iron deficiency anemia or any type of anemia during the course of their pregnancy. So this can extend even into the postnatal period. Just gonna start. Can you please open your eyes? We're going to be checking for any paleness in the eye and the cornea. Please open your tongue, ma'am. We're going to be evaluating the tongue for any paleness. Thank you. We're going to be evaluating the capillary refill. Thank you. Any pale skin? Any paleness? Okay, thank you, ma'am. Okay, ma'am, now we'll be moving on to evaluating your perineum. So is it okay if you undress just for a moment, just to evaluate the perineum, just to expose it so we can evaluate any abnormalities with your perineum? Is that fine? Okay, thank you. Okay, now that the perineum is exposed, please lift your legs up. Thank you. Are you still comfortable, ma'am? Please let me know if you feel any uncomfortability, any pain. Thank you so much. Yes. We'll be looking and evaluating the perineum for any signs of any hemorrhage, if there's any hemorrhage left. Any postpartum hemorrhage, we'll be evaluating the perineum for any sores, any what. We'll be evaluating for any tears, unhealed tears that are still bleeding, that might cause a threat and might extend to actually cause a hemorrhage. We'll also be looking at the pad, the patient's pad. We'll be looking at the lochia. This is your day 3, ma'am, post NVD. So it is normal that you find lochia rubra on the patient who's day 3 post NVD. We will also be evaluating for any hemorrhoid on the anus of the mother. Okay, thank you. Okay, with the lochia, we'll also be evaluating for the amount of the lochia. If it is the pet food after a duration of 2 to 4 hours, if it's soaking wet, that may denote hemorrhage. The blood should be bright red since the mother is only post NVD day 3, as it is now. Okay, thank you, ma'am. We'll be moving on now since the patient is already exposed to be evaluating the patient's lower legs. Is it fine, ma'am? We're just going to be checking for any signs of DVT, any varicose veins on the mother. We'll be doing the pitting edema test, which shows a dent in the skin after a duration of time to denote edema. There is no edema on the legs, on the lower limb. Thank you, ma'am. You can just remain comfortably. Thank you so much. Thank you so much for the exposure. You can put the pad back. Thank you, ma'am. Okay, ma'am, now we'll be moving on to evaluating the involution of your uterus. If your uterus has um, um, accurately went back to its size, not necessarily its normal size, but it shrink a bit to show that the baby has been delivered. So we're going to start first by palpating, to palpate the size of the uterus, and then we're going to measure the uterus's FSH. Okay, it's 22 centimeters, which is lesser than the SFH you had when you delivered the baby, which shows good involution of the uterus. We're looking at the size. The size is an adequate size. It does not equate. It does not show any megaly of the uterus. The uterus is involuting adequately. Thank you so much, ma'am. Now we'll be moving on to evaluating your breast. Is that fine? Are you still okay, ma'am? Are you still comfortable? Okay, thank you so much. With the breast, we'll be looking for any engorgement. We'll be looking for the nipples, the inverted nipples, are they symmetrical? Any lacerations on the nipples? Is the baby latching well, ma'am? Okay. Are you able to breastfeed well? Is there any milk coming out? Okay, thank you so much. Okay, we'll be palpating for any lumps also on the nipple. Okay, thank you, ma'am. There is no presence of any lumps on the nipples. If the patient has engorged breast, you'll see the breast thickened, the nipples protruded. Are the breasts painful, ma'am? They're not painful. Okay, thank you. You also evaluate for any nipple fissures, any nipple lacerations, any discharges from the nipples, foul discharges, green, yellowish discharges. The mother is lactating well. Thank you so much, ma'am. Okay, ma'am, I'm just gonna ask you a couple of questions just to hear your general well-being. I just want to ask, how is your feeding? Are you eating well? Do you vomit after you eat? Okay, and are you passing stools? Have you started passing stools yet? Okay, not yet. Are you passing urine normally? Okay, there's no pains while passing urine. There's no diarrhea. Okay, thank you so much. And how about your sleeping patterns? Have they changed ever since you delivered your baby? Are you able to get any adequate sleep? Okay, are there any stressors maybe that may be keeping you up at night? It is hard sometimes to stay awake with a baby, hence you need to continuously wake up to feed the baby. But other than that, is there anything altering your sleeping patterns? Okay, thank you, ma'am. And how is the bonding with the baby? Is the baby able to latch appropriately on the breast? Do you feel the baby latching and actually extracting the milk? And how does the baby feel after latching? Does the baby cry for more milk, or does the baby usually feel satisfied and able to sleep after latching, which shows that the baby is feeding? Okay. And how have you been, ma'am, after the delivery? How do you feel about receiving your new baby? Can you please tell me more about that? Okay. You feel excited about the baby, okay? Do you normally have hormonal blues, which mothers usually have after birth when they get anxiety and depression after birth? after delivering the other baby. Some women even get postpartum depression, which is totally normal, but may need for you to be referred to a psychologist to speak to them, as it is a psychological disorder. You haven't experienced any blues, any hormonal blues. Okay, thank you. And do you have and how about your appetite, man? Do you usually have a low appetite or a high appetite ever since you delivered your baby? Okay. You are eating frequently and normally. Okay, thank you. And I would just like to ask you, ma'am, if that's okay, about pain. Do you have any pain on your body at the moment? You have a pain on your perineum. Okay, and usually what aggravates the pain? When you walk, okay? The pain is due to the episiotomy. Yes, that's totally normal to feel pain after the episiotomy. It was a surgical procedure that involved incising on your perineum, so it's quite normal to feel pain after delivery. And if you can rate your pain from a scale of 0 to 10, what would you say the pain on the perineum is? Okay, a 6. Okay, a 6 is adequate. Okay, ma'am. And usually, are there any other factors that aggravate the pain? Okay, okay. All right, thank you so much, ma'am. Thank you for your time. We are done with the procedure. We've evaluated your body, and thank you so much. And I'd just like to further ask, ma'am, with some of your social relationships, do you think you have any support from home? Are you married? Are you single? Okay, are you with any relationship with the father of the baby? If I may ask, if it's a sensitive question, then you can opt to not answer it. Okay, you are married, so you receive support from your husband and any work colleagues who are willing to help with the pregnancy, people you can reach out to, you can talk to in case of any psychosocial needs that you may have. You have a friend at work, okay? And is there anyone else who's assisting you in this moment? Your mother-in-law. Okay, thank you so much, ma'am. After the evaluation of Mrs. P through the postnatal assessment, we were able to identify a need and a problem that Mrs. P presented with that can be assisted with through the process of the nursing process. We started first by formulating a nursing diagnosis, which includes altered comfort due to the episiotomy the mother have, as evidenced by the mother verbalizing that she has a poor gait due to the pain, and also through the verbalization of the pain score by the mother. Some of the objectives that were formulated to help this identified need includes placing the patient in a comfortable position, administering analgesics that are safe for the postnatal mother, performing vital signs in order to evaluate the prognosis of the pain. In this case, it can be an increased blood pressure or an increased heart rate may denote that the mother is in severe pain. We would also encourage the mother to not engage in any strenuous activity in order to allow the body to heal. These identified needs and also the objectives formulated were all regulated by the Nursing Act of R2498 and also the Regulations Act of R2425. Thank you. Some of the supplies that were used in ensuring that the mother is cared for and also the nursing diagnosis has been that the objectives have been followed include a pillow, your cot size, a BP machine, a thermometer, a watch for counting the respiration, pads for the lochia of the mother, medication, measuring tape, amongst others.